Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about dermatofibroma. Definition: a dermatofibroma is an area of focal dermal fibrosis often accompanied by outlying epidermal thickening and hyperpigmentation. It appears clinically as a brown pupule or small nodule, often more indurated than elevated. The origin is unknown, however, it is probably a response to trauma. Incidence: dermatofibromas are common and are often found incidentally during cutaneous examinations. Occasionally, they cause a patient to seek medical advice. They are seen most often in young adults. History: dermatofibromas usually are asymptomatic. The patient's concern, if any, is over the possibility of malignancy. Physical examination: typical dermatofibromas are approximately 5 mm in size and are slightly elevated. They vary in color from a light turn to dark brown. The fibrotic nature of the lesion is best appreciated by palpation, which reveals a firm consistency. A helpful diagnostic test is the Dimple sign, in which pinching results in central dimpling. Most dermatofibromas exhibit this sign. It is rarely seen with any other skin lesions. Dermatofibromas may occur anywhere, but the thighs and legs are the most common locations. One or several lesions may be present. Dermatofibroma: a firm reddish pupule with dimple sign. Epidermis is slightly thickened and hyperpigmented. In dermis, nodular aggregate of fibroblasts and densely packed collagen is present. Differential diagnosis: with its brown color, a dermatofibroma may be confused with a nevus. Nevi, however, are usually softer and do not exhibit the dimple sign. Darker dermatofibromas may raise a clinical suspicion of melanoma. Dermatofibromas are usually pearly brown, a benign color, whereas a nodular melanoma usually has shades of dark gray or blue. If any doubt exists, however, a biopsy should be performed. Dermatofibrosarcoma protuberans is a low-grade malignant fibrous tumor that grows slowly but persistently and rarely metastasizes. It is a rare tumor and is distinguished clinically from a dermatofibroma by its larger size, irregular shape, and continued growth. Note: the dimple sign is characteristic of dermatofibroma. Note: enlarging or atypically colored lesions should undergo a biopsy to rule out malignancy. Laboratory and biopsy: the diagnosis is usually made clinically. If any doubt exists, a biopsy should be performed to rule out a malignancy. The histologic picture is diagnostic and shows a focal proliferation of densely packed collagen bands that are twisting and intertwining. Fibroblasts are interspersed and increased in a number. Increased pigmentation of the slightly thickened outlying epidermis accounts for the frequently brown color of these lesions. Therapy is usually not indicated. If desired, a simple excision is sufficient for removal and histologic examination. Course and complications: dermatofibromas are chronic and usually stable in size. They are not associated with any complications. Pathogenesis: although the origin is unknown, trauma, example an insect bite, may be an initiating factor for some of these lesions. The proliferation of fibroblasts and subsequent fibrosis may represent an exuberant healing response to injury. However, most patients do not recollect a history of trauma in their era. Two other lesions are considered within the spectrum of dermatofibroma. A histiocytoma, an aggregate of histiocytes in a focal area within the dermis, probably represents an early phase in the formation of a dermatofibroma. A sclerosing hemangioma, as the name suggests, shows more of a vascular component, but the end result is that of dermal fibrosis as well. Clinical case: A 32-year-old woman presents with a small bump on her lower leg that she noticed several months ago. The lesion is firm, painless, and has not changed significantly in size. She thinks it may have developed after an insect bite. On examination, there is a firm hyperpigmented pupil on the lateral aspect of her left calf, measuring about 6 mm in diameter. When the lesion is pinched from the side, it produces a central dimple sign. No ulceration or bleeding is present. Which of the following is the most likely diagnosis? A. Nodular melanoma, B. Dermatofibroma, C. Epidermoid cyst, D. Kaposi sarcoma, and E. Basal cell carcinoma. According to our explanations, the correct answer is dermatofibroma. Explanation. Dermatofibroma is a benign fibrohistiocytic tumor often found on the legs of women, commonly follows insect bites or minor trauma, as we explained. Characteristic findings include firm pupil or nodule, hyperpigmented or brownish color, dimple sign or central depression when squeezed laterally, and usually asymptomatic and stable in size. Differential diagnosis include nodular melanoma, which is a rapidly enlarging, asymmetric, often darkly pigmented lesion without a dimple sign. An epidermoid cyst is a mobile subcutaneous nodule with a puncture, and Kaposi sarcoma is violaceous plaques or nodules, often in immunosuppressed patients. And basal cell carcinoma is a pearly pupil with telangiectasia and may ulcerate. Okay, this was an explanation about dermatofibroma. Thank you for your attention.